Good morning. Today, on the first day of winter, it gives me great pleasure to interview Dr Joan Mila, consultant immunologist in Son Espases Hospital. Also, I'm very glad that we are here to do the interview today, because many people were prophesying the end of the world. So, it is not the end of the world, and good morning, Joan.
Good morning. So it's your last interview.
It's my last interview. Okay, I'd like you to tell me something about yourself, or tell the viewers something about yourself first, Joan.
Okay, thank you, Jonathan, for having me today. Good morning. My name is Joan Mila. I am 60 years old. I was born in Barcelona, the capital of Catalonia, little country in the northeast of Iberian Peninsula. I studied my first studies in Badalona, 9 kilometers north of Barcelona. When I tried to study higher education,
Yes.
I went to Barcelona and I applied for the university. In a week, I decided, only in a week, I decided to study medicine.
Mm-hmm.
I was doubtful about some sciences, all about nature, about biology, chemistry, and also medicine. But to be true, I decided in a moment to study medicine due to my best friend, who also decided to study medicine.
This is, in the words of James Joyce, this is called an epiphany, no? A moment of inspiration.
Yes, I remember it very well when I told my father my decision. My father was his eyes were very open, because I never said nothing about this
Before, no? And immunology, why did you, the decision to become a doctor was, or to study medicine was in a moment, and to study or to go into immunology, why did you become an immunologist?
My career path is a little bit complicated, because I started applying for the national system, BIM and IR, and I was in Valencia 1 year, doing my clinical internship in Hospital General in Valencia. And after this year in Valencia, I applied for immunology in 1980. The year 1980 was the first promotion of immunologists in Spain.
Okay.
And I was accepted in Hospital of Belviche in Barcelona during 4 years until I finished my studies.
Okay. And then from Belviche you came to Son Espases?
After Belviche I was without any job during 2 years, the same as nowadays for many people. And I was contracted by a private company, an American company, during 1 year. I was selling products in different labs. And after that year, I came to Son Espases, and since 21 years, I have been performing my job in
And many people are very happy about that, Joan. Very, very happy. I have asked your colleagues to give me questions. So a lot of the questions are come from your colleagues. And the first one is a question which is actually was asked by 2 colleagues. What is the role of the immunology laboratory in a 3rd level hospital?
Okay.
Nowadays, what is the role?
Okay. First of all, I have to explain a little bit that immunology as a science is a branch of biomedical science. It's not only medical, it's a biomedical science. So, as a biomedical science, we perform several tests that covers all aspects of the immune systems in health and in disease.
Okay.
We can study the immune status of health people, and we can study the status of diseases. People
Or
who are
unhealthy people.
unhealthy people. In immunology, coexist different kind of professionals. Coexist medical staff who treat patients, diagnose, evaluate, and treat patients, and pharmacists, biologists, chemists who perform several tests, mainly in blood samples, focused on cells of the immune system, of different molecules of the immune systems. Always, we refer to the hospital settings, always directed to human status of the immunological, the immune system.
Okay. And do you think there should be two different specialities? Because you say immunology encompasses a very broad range of activities. Do you think there should be two different specialities, clinical and laboratory?
No.
Do you think they should be divided?
I don't think so. In my opinion, I strongly are in favor of to be a team with a good link between more basic and more clinical focused people in a clinical hospital of third level, because the tests are very complicated, usually best performed by biologists, pharmacists, chemists than for physicians.
And a physician, for example, an immunologist who's working on seeing patients and working in a lab, is this an advantage?
It's a great advantage, because in order to understand the complexity of the disease of the immune system, we need to understand what test we are applying.
Yes. Okay. Is it possible, this juggling or this working with research and the daily laboratory work? How easy is it to juggle the two things?
It's a good question, because it's very difficult to combine, to separate your mind, your brain, when you perform investigation and when you perform routine tests or routine examinations. But it's necessary, because we are working in a third level hospital with a great role, in my opinion, teaching and also in research. So it's completely necessary to combine the research and the clinical.
And do you, Joan, have any specific strategy to combine, to juggle these two? Do you?
Not in my case, because I am a little bit chaotic, and sometimes I am attending patients.
Yes.
But in the same moment, I am thinking in research with this kind of patient. Other fellows, other lab mates are more scheduled and can separate very well their time when they perform research, very focused, and when they perform routine test or routine attendance of the patient.
But you know what Nietzsche said? You know what Nietzsche said about chaos, no? The creativity comes from chaos. Maybe the creativity, the intellectual ability comes from the chaos.
From the chaos, because
I don't know. This is.
We are not able to wait or to expect, to predict what kind of patients will come, what kind of test will be asked, and we have to be prepared in the same schedule, in the same journal, and the same day,
working day,
to make different, to do different things.
Multitasking.
Multitasking. To be flexible enough.
Women and wives don't think that men are able to do multitasking. I don't know whether you agree or disagree.
I agree. Totally.